pikin in condition. This is backbone, so the bone all of the ribs all, the belly, the footing, you know, them be saying a cripple, not the worker.
Proper nutrition is a powerful good, and children who are well nourished are more likely to be healthy, productive, and do very well in school. And this will be very beneficial to their families, the community, and the world at large. It also prevents child and teens issues such as undernutrition, eating disorders, obesity as they get older. A malnourished child experiences developmental and cognitive delays, weight loss, and illnesses. And all these kind of lead to consequences in the short term and the long term. In the short term, we know that it delays development, which occurs in the first few years of life. Nutrient deficiency can have major short-term implications in young children, including impaired immune and growth implications. For the long terms, it traps people in a lifelong cycle of poor nutrition, illness, poverty, and inequality. And the damage done to physical and cognitive development, especially during the first 2 years of life, is largely irreversible.
Mina Zainab Sise, Adewo 387 Hill Station, Sunshine Valley. My own group, United We Stand, na the 9, na me make 10 me the leading mother. I joined this communal group 2013, where I go train me why I don't turn leading mother. At the old meeting, 2 times per month, they go and sensitize the comrade. How for take care of pikin, how for breastfeed pikin inside 6 months, enough for give and water. Like me own self now in 2 months, some week, now then I'm young so why they take care of her now only breastfeed. Don't you for wash your hand before you they feed them. You for even take care of in toilet, not for allow it around you. Though you not for allow incompetence map na do, and they make pikin them malnourished.
For Sierra Leone, in the process of ensuring we improve our nutritional status, we have established the mother support groups at community level, and that is one key structure that we use. We have these mothers being formed into a group, and it consists of not more than 15 mothers, wherein you have pregnant women, lactating mothers, elder toddlers, teenage pregnant women, you have teenage mothers. The idea in order to serve as role models to other mothers in the area of infant and young child feeding. As community group, they do have community gardens or backyard gardens where they grow their vegetables and other foods that they can make use of. Some can even use it for income generation, and it keeps the group going together.
This community be there, the pikin they all be the demote. Most of we be the don't self they talk about with sister and say na banfa and they banfa the pikin them. But since the ACF go train me, I can go any hour now then ask them for go know how them they how the pikin and they do, how they talk to them, how for go na hospital. Now me on work that purposely now where they pa. I can come out, I go straight to the hall, then I call meeting, we all can sit down, we talk. But where the day they come, within the week they reach, I go to all my house, I go visit all my house, ask you how they do, how you picking they do, then I talk to them, I can, me on work that where ACF give me.
At the community level with the support group, they ensure they carry out self-screening for infants 6 to 59 months. And whenever they do the screening, referrals are being done because they have been trained and they know that if a child falls within the yellow of the mark tape, they are being referred to the health center. And if the child falls within the red section of the mark tape, they're also being referred.
When they get to the health facilities, passive screening is done in the health facilities, wherein the health workers do growth monitor and screen these children. They use the height board, the scale, they also use the mark tape, and they do check for edema. So with this screening, the children can be classified based on their nutritional status.
In terms of the QAT, we have integrated management of acute malnutrition. This is also divided into three major components. You have the IPF, which is the inpatient facility, and that's for treatment of severe acute malnourished children with medical complications. They are inpatient. And we have the OTP, which is outpatient therapeutic program. These are severe acute malnourished children without medical complications, so they are not inpatient. They are treated within the community. And we have the supplementary feeding program, which is for moderate acute malnutrition. Malnutrition reduction in Sierra Leone is really on the right path. In 2010, when we did the SMART survey, stunting was 34.1%. And last year, when we did another survey, it was 28.8%. Underweight, which was 18.7%, is now 12.9%. And wasting was 6.9%. Now it's 4.7%. So in terms of reduction, we're seeing some gains, and we're going to make sure we continue in that path so that we can reduce the prevalence of malnutrition tremendously in the country.
ACF supports the Ministry of Health and Sanitation in Sierra Leone in the fight against undernutrition. ACF interventions are linked at capacity building the health staff and the health structures in detection and treatment of severe acute malnutrition. At the community level, ACF teams are working with mother support groups in the promotion of infant and young child feeding practices, in addition to promoting good hygiene behaviors at the household level. Further, our teams are involved in promoting diet diversification by providing the means and tools to mother groups to have kitchen gardening and community gardening. In addition to supporting mother groups at the community level, ACF teams continue to support community health workers in the detection and referral of children with severe acute malnutrition. Clean water and adequate sanitation facilities remain a key element in the fight against undernutrition. ACF continues to work at the community level and the health facility level to improve water and sanitation facilities in Sierra Leone. ACF partners up with the Ministry of Health and Sanitation, Ministry of Water, Ministry of Agriculture and Food Security, national, international NGOs, local authorities, and civil society platforms.
The Scaling Up Nutrition movement in Sierra Leone was signed up to in 2012. The SUN movement is a global establishment whereby countries come together with different partners to try and fight against malnutrition. The government of Sierra Leone joined this fight to try and improve the nutrition status of women and children in our country. The basic principle of the movement is the fact that everyone has the right to access to food and good nutrition, along with clean water, access to clean water, good sanitation, and social protection. So the government is trying to work towards these issues, and the aim is for us to try and meet these possible targets in the near future. With the civil society, which we're based with, we try to collaborate different partners and work together in our efforts at national and district levels to promote, to advocate for good nutrition and access to food, as well as other new areas which we consider to be nutrition sensitive areas, such as clean water, sanitation, education, protection, and food security. And we do a lot of advocacy at national level, and we also do social mobilization at community level. Our aim is really to try and pull all our partners together to work collaboratively in ensuring that we meet our nutritional status, which we've signed towards at the global level.
We have very high level commitment for nutrition and the reduction of malnutrition in the country. We have the SUN Secretariat in the Office of the Vice President, and the Vice President himself is the SUN focal point for the country. By the end of last year, we recruited over 30 nutrition officers to cover the whole country. We can now boast of public health nutritionists in all districts and clinical nutritionists in all districts and national hospitals in the country. The Vice President just recently launched the Food and Nutrition Security Implementation Plan, and that plan is a costed plan, and that's a milestone for us because now we have a costed plan that donors, partners, and everybody can work with. nutrition is very important. It's in the government's agenda. It's also part of the health sector recovery plan. We're also scaling up treatment centers for severe and moderate acute malnutrition, and also scaling up the mother-to-mother support group, which primarily is the backbone of prevention at community level. It is known that a healthy nation is a prosperous nation, and therefore health is wealth, which makes good nutrition the way to go.